So we're going to start on time, but we need to because we got a lot to cover tonight. So thank you guys. It's kind of nice to have light out at 5:30, right? It's like spring is trying to come. Okay, so I have a lot to say tonight, and I do want to. Before I start, I want to comment on the Facebook page. There's so much going on there, and I see some of the questions. I try to comment on some of the things I see, but I don't follow everything. But I want to tell you that those of you who have questions and you're not getting them answered, I usually try to answer them if we've already covered the information and you just missed it. But some of the questions are going to be answered in the next couple of weeks. So if I don't answer them when we cover that topic, make sure you ask me after class or when we're done here, because I want to make sure your questions get answered. That's really, really important. A lot of you are putting your smoothies and other things on, and I think that's great. Most of what I'm seeing is really good. I'd say all of it's really good. As far as our dietary changes, we're going to talk about the next couple of weeks. All I'm trying to get you to do is move from where you are now to better, because you can go extreme and never have a sweet or never have anything with caffeine, or you can say, hey, I stopped eating a whole pizza and a big Pepsi. I'm only doing half of that now, and that's going in the right direction. So I don't want you to feel like you have to be perfect with all of this. I just want you to improve. If we strive for perfection, then we're all failing, and then we're beating ourselves up, and it doesn't help. So, but I have seen a lot of those questions. So let me see if I can get this to work here. Okay, so you see my arm wrapped up? You didn't see, you saw, I think I showed you my arm Tuesday night, right? Without a wrap? That's what it was like Saturday night. And the reason I put this up here is I was struggling with why is all that bleeding, because what I did was I bumped it right here and I got a big goose egg there, but then I have this bleeding. I have a friend who works at Dover Orthopedics, and he said, I think you have this condition right here. So what happened is the skin right here and the fat underneath it is being fed. This is the muscle, and there's a thin layer there where the blood vessels feed the skin and feed the muscle. And the shear force that I hitting it just tore this layer, just tore it right off, so that it just bled, and it followed the skin down all the way to the back of my hand and to my wrist. The night after this was swollen and sore, and I raised my arm, and I was actually just pushing the swelling down, trying to get out of the forearm. And I got a lot of the blood to come halfway off my arm. So I thought it was better. Didn't really do much. Just made it look worse. So I get more sympathy. But it was a week, and I was like, this is not getting better. This is really throbbing. So I went to the orthopedist, and he said, yeah, you're going to be okay. If you're not better in a week, we'll get an MRI. And so this was yesterday morning, and he wrapped it up for me, and I kept the wrap on all day and all night, and in the morning it was a lot better. I'm like, okay, it's healing. So I'm just keeping the wrap on because it seems to be working, but this kind of worried me a little bit. Because with these kind of injuries, you can get infection and you can get necrosis of the fat layer there and end up with surgery. So I was afraid I might be heading that direction, but I think I'll be okay now. So as I was thinking about this, I violated one of nature's 3 laws. Remember we talked about that? Balance and order, sequence and harmony, and interdependence and independence. And what I was doing wrong is I was expecting this to heal a lot faster than it should. I didn't want the inflammation, and nature says it's a timing thing, right? It's order and sequence. This swelling is acute inflammation. That's part of the healing process. It was just swelling so much it was hurting, and I thought it should have cleared up faster. If I'd have given it another day, I would have been okay. But that's the process of healing. So I'm confident that in a couple weeks, that arm is going to be completely fine and functional and with no other ill effects. So even I have to remind myself to do the right things and not get impatient.
You did the other rule wrong. You
What's
should
that?
have passed the guy trailing instead of trying to go for the layup.
Yes. But, you know, I don't know, did I tell you, I made like 3 3-point shots with this arm. Yeah, I should pass more than I shoot. I get it. I usually do. All right. So I thought you guys might appreciate this little joke. I have to confess, while I was in pain and distressed about this, it wasn't quite this bad, but I was more like this than you guys are. So, all right. So there's a couple of new slides that you didn't see in the presentation this last week, and this one was a family practice journal, a family practice news article, just from a couple years ago. I thought this is really interesting. They often have these debates in the family practice journals, and these are 2 different doctors debating the prevention of heart disease with cholesterol medicines. And this is a quote directly, well, no, this isn't a quote. This is a summary of what they were arguing about. So they were talking about prevention. You see, well, you can't see the title there. Title says, Primordial Cardiovascular Prevention Draws Closer. So talking about how do we prevent heart disease. And prevention in this article refers to controlling blood pressure and cholesterol levels with medications. That's how they're saying we prevent heart disease. Blood pressure, cholesterol medicines. Now, have you got my take on cholesterol medicines? That they don't prevent heart disease. They help you once you have heart disease to not continue to have issues, but they're not perfect. So here's the thing about this. Nowhere in this debate was the root cause of the biochemistry addressed. Because do you guys remember what the cause of heart disease is now? It starts with an I. Inflammation. There you go. I just explained this to a guy as my last patient today. 68. He'd had open 3-way bypass 2 weeks ago. And he said, they put me on cholesterol medicine and my cholesterol is fine and my family doesn't understand it. So I drew him a picture. The reason you're on that is so this plaque doesn't rupture. It puts a protective film over the heart disease. But it also will cause potentially other issues. But in his case, he's probably better that he's on that. Okay, so they didn't address the root cause. So they're arguing about blood pressure medicines and cholesterol medicines. They're arguing about medications. Now, that's kind of what you would expect, right? Which ones are the best? But the most important point is this little box down here in the bottom of the article. So Dr. Ferentz reports receiving fees from all these drug companies. So what do you think his message is going to be? I have to argue for this. Number one, I believe it. But number two, I'm being paid by them. Okay, so to me, that's immediate bias. Why would you even, if you're going to admit that, I don't even think that's a fair argument because you're biased already. Okay, so just an interesting article. So we talked about, this was about nutrition and disease. The first thing we talked about was how healthy are you based on your blood levels. So we talked about the range of normal. And when you look at your blood test, most people aren't going to be normal on every test. But normal doesn't mean necessarily you're healthy. The range they come up with where they say is normal is where 95% of the population falls. How healthy is 95% of Americans? Maybe not the best example of health, but we're saying, well, that's where most of us fall, so we're going to call that normal. But there are going to be a small percentage of people that have normal levels for them that are lower. Some people are going to be a little bit higher. So if you don't have numbers in this range with everything, it's probably not a big deal. The most important message is when you get your annual health screens is that you look and you see if your numbers are still in that same range or if they've moved a lot in one direction or another. So everybody's normal is different. Okay. When we talk about hormones in week 11, you never want to be told your hormone levels are normal, you're fine, a thyroid, estrogen, testosterone, whatever. You never want to be told you're normal and have a level down here. You want to be told your numbers are normal and they're on the high end, because that is usually more optimal. And then I always tell people, remind them that a hormone level in your blood has nothing to do with the hormone levels that get in your cells. When they're in your cells, you feel good. I saw a lady today who'd been on hormones in Columbus. She was getting implants of estrogen and testosterone implanted under her skin. She felt great for a couple months, and then she felt like it was too much, and she was telling me all about it. And I was explaining to her that those levels, she said, I got dry skin, a lot of hair loss, I'm tired and my hands and feet are cold. I said, your thyroid is low. I already know it's low. I don't have to measure it, I will, but I know it's low. We'll put you on thyroid just so you don't have to wait. I'm not looking at a number, those are classic symptoms. So we're gonna make her feel as good as she needs to feel. Okay, and we talked about chronic disease and the link between nutrition. So this week was all about foods that make us sick, whatever it is, arthritis, pain, high cholesterol, heart disease, blood pressure, obesity, all the foods, all the key indicators in our diet that cause us to be ill. Next week, we're going to explain how foods can heal you. The following week, we're going to apply that and say, okay, now this is how you put together a healthy meal plan. The last week of a nutrition part of the series, we're going to say, let's help you understand what a food label is. It's like applied nutrition, everything you've learned. This is what you don't want to see on the label, this is what you want to see. So you'll be really good at all this. But this week is a ton of information, so you might have to go back and either look at the workbook and read some, or go back and watch some of the video, because it's a lot. But anyhow, we talked about the environment having a role in our health. And you can see that when it comes to cancer, the cancer-causing factors, you can see that diet and tobacco are the majority of the triggers for cancer, right? Those are both things that we can do something about. We can improve our diet, we can stay away from the tobacco. Alcohol, there's a small percentage of people that drink too much alcohol, and that puts them at risk. Okay, here's another article that this was from the Journal of American Medical Association, and it was in, let's see, looks like it was a little bit older, but I found it and I thought it was pretty important. A recent review of more than 1,000 studies concluded that sufficient evidence exists to the link of weight gain, overweight, and obesity to 13 cancers. So we talk about diet, we're kind of implying that if your diet isn't good, you're going to be overweight or obese. Here are 13 cancers that are linked with being too heavy. Here's another slide that shows you this obesity-related link to cancer. And so these cancers, you can see prostate cancer, there's a small link. The more obese you are, the more likely you are to develop prostate cancer. The one that really jumps out is liver cancer. There's a high link with being obese. And well, I'll show you why that is when we get to the specimens and we talk about cirrhosis. Okay, but you can see that, pancreatic cancer has a pretty high link to being obese. And then some of these other ones are also in there. Okay, so just showing you that if we risk our health when we stay overweight. And then here's one more slide, obesity-related cancers. Same kind of information, just looking at it differently and comparing the United States against England. Okay, so if you want to reduce your risk of cancer, one thing you want to do is try to get an ideal body weight. The other thing that you want to do, if I didn't say it in the lecture, keep your sugar intake down, because sugar will feed cells that are growing fast. And you don't want a lot of sugar in your diet, especially when there's cancer going on. Okay, then we talked about heart disease, the #1 killer. Hopefully you have an understanding now of, what happens when there's a blockage. If it's the widowmaker blocked here and it kills the heart muscle here, you will probably die. If it's a little branch right here that gets knocked off, That'll be indigestion one night that you'll think that was really bad, and I got really sweaty with that, but I guess I'm okay. That was, we call it a minor heart attack that you don't realize it was a heart attack. Okay, so it depends on how big of an area the muscle is injured as to how bad you feel with symptoms. The guy I was seeing today who just had his bypass surgery, I asked him if he had chest pain, shortness of breath. He said, no, I was just getting tired. And he had Parkinson's, so they're going to be tired. But I told his wife, I said, that's one symptom that women often have. You ask, do you have chest pain, shortness of breath? No, but I notice every time I vacuum the living room, I have to stop and rest for a few minutes. I have to sit down. I just get really tired. That really worries me when I hear that. So just be careful with those. Okay, then I don't know if we showed you this, but this is the progression of heart disease. And we'll show you this here with some real specimens. But this is from our specimen bucket from about 10 years ago. This is the inside of a healthy artery, nice and pink and smooth. These are fatty streaks of, the reason it's yellow is because it's fat deposition or cholesterol deposition. We see that in teenagers. Usually some kids by the time they're 10, they start to develop this. This should not be. And then when it progresses and we're older, we have more plaque, and you can see the plaque build up here, and you can there's calcium deposits in that. When you touch that, it feels hard. Okay, so that's the progression of heart disease. Okay, so these are the heart disease risk factor. There's primary and secondary. So when you come in my office with chest pain, I have to decide how much I need to worry about you. So I look at the primary risk factors first. Number one is your family history. If you got somebody in the family before age 65, a first-degree relative, a sibling, a parent that's had a heart attack or something heart-related before they're 65, that's a major risk factor, a major concern. You may be like your other parent and not have any risk at all, but if you're like Dad and he had a heart attack at 60, we got to really be careful that you don't have that susceptibility. In my case, both parents had their open heart surgeries in their late 70s, early 80s. So it's not quite the same family history for me, and I'll explain what happened to them in a minute. Diabetes is another big risk factor in smoking. Those three, really, it's like, it's probably going to happen. You're probably going to have an issue if you got those three. But if you got a strong family history and you're not diabetic or you're smoking, you're still going to be at risk. We got to really watch that. High blood pressure, a little bit of a risk, and then cholesterol. But yet that article I showed you, they were arguing over the least two important ones for the major risk factors, right? Those three on the top really put you at risk. And the reason is if you got a strong family history, you have more inflammation in your arteries for some reason. Diabetes clearly makes you more inflamed, and smoking damages the lining of the arteries and causes more inflammation. So those are the primary risk factors. Three of these make you really at risk, especially the first three. And then the secondary risk factors, the secondary risk factors are other things that you can measure to kind of see if you're susceptible. Like we used to offer this C-reactive protein. It's a test, and a lot of people were really high with this. When this is high, it usually means your insulin levels are high. That doesn't mean you're diabetic. It just means you eat too much bread, too much carbs, too many sugars, and you have high insulin. Not diabetic, you have to measure the fasting insulin, but if your insulin is high, your body will be inflamed, and it will cause the C-reactive protein to go up, and it will lower your nitric oxide levels. So I'm coming back to nitric oxide, less blood flow. Men struggling with erections. Blood pressure just going up all of a sudden when you're 40 or 50. Okay, so those foods will cause inflammation and lower your nitric oxide. You won't have the energy, you won't have the blood flow, you maybe won't think as clearly, and men usually can tell that. And women can too if they pay attention to their clitoris when they were younger versus when they get older, and how enlarged and aroused it gets. Then there's visceral obesity, so just having belly fat. If you got that belly fat, you probably have high insulin levels, lower nitric oxide. So I had a patient who had erectile dysfunction. He was 60. He was a pretty healthy guy. I mean, he lifted weights. He looked pretty good. He's about 30 pounds overweight. Everybody in his family was having heart attacks before the age of 60. I said, you need to really be careful. You need to go on a really clean diet. He went on the diet and he lost that gut and his nitric oxide level was corrected. His erectile dysfunction was gone. Didn't need Cialis. Inactivity, that also is linked with high insulin levels that lowers your nitric oxide. When you're exercising, you're stretching your arteries and they're starting to get smart. They're saying, we got to stay dilated, so we need to make more nitric oxide so this person can perform their exercise better. Elevated homocysteine, this is I'll show you a kind of a complicated slide on this, but this is something that you can ask your doctor to measure. If it's abnormally high, which is probably a level greater than 10, you need to take B vitamins to fix this. And I'll show you, my parents, they had a problem with this biochemistry. Type A personality, because their adrenaline's running high and they're always kind of wired. So that can cause increased cortisol, which is a stress hormone, which increases insulin, which causes inflammation. So we're coming back to inflammation on most of these. And then if your hormone levels are off, your risk of heart disease goes up. If we can do a complete hysterectomy on you ladies at 30, take your ovaries out, no estrogen for 20 years, your risk of heart disease goes way up. And men, when your testosterone levels go down, heart disease risk goes way up. If you got prostate cancer at 50 and we knock off your testosterone permanently, your risk of osteoporosis as a man and heart disease goes way up. These are good protective hormones that you should have optimal levels your whole life. And we're going to talk a lot about that more when we get further along. So here's the list of when your nitric oxide levels are low, these are some of the things that can develop. Even Alzheimer's or dementia can develop. Chronic inflammation, blood clots, immune dysfunction, uncontrolled cell growth, which is cancer. All that because you don't have nitric oxide. So again, if your blood pressure's always been normal and it's going up, you got to think, do I have a problem with nitric oxide? And if that doesn't scare you, look at all the potential problems that might develop if you don't try to get those low levels back to a higher level. Okay, so the nitric oxide, there's two ways you make that in your body. One is you make it with an enzyme right here. This takes an amino acid, arginine and oxygen, and that enzyme will make nitric oxide. The problem is this is a really complicated enzyme, and there's a lot of cofactors that have to happen for that to work. And with the wrong lifestyle, too much sugar, that enzyme won't work, or not work as well, will accelerate the development of problems. So that's about how half of the nitric oxide is made in your body. The other half comes from getting the right foods in your diet, and these are green leafy vegetables. So we know that green leafy vegetables have nitrate in them, and most of us only get half the green leafy vegetables we should have in our diet. When we have a green salad mix and we chew it really well, and we have a healthy mouth, we have bacteria on the back of our tongue. These two different bacteria, or this bacteria carrying this enzyme, converts the nitrate into nitrite. And then we swallow that food that we've chewed well, that we learned about in week 2 to chew your food well. And in the stomach, you have all these enzymes in an acidic stomach that convert the nitrite into nitric oxide. That's how it's intended. So I don't know if I told you, this is kind of a fun fact. Mother's milk understands this biochemistry, because the first 4 days of mother's milk, there is no nitrate in mother's milk. It's strictly nitrite. Did we talk about this? Okay, because it takes 4 days for the baby to get these bacteria in their mouth. And 4 days later, once that bacteria is there, mother's milk says, we don't need this anymore, we're gonna make this. So nature's pretty smart. So now the other problem with babies is if you're born C-section, when a baby normally comes out with the head down, it comes out through the birth canal, and the head goes like that, and it smears its mouth and its nose right by the rectum, and there's always feces that comes out. We probably shouldn't sterilize that. That allows the babies to kind of sniff in those bacteria from mom's rectum. It sounds disgusting, but that's how they start to colonize themselves with healthy bacteria. So a C-section baby is going to have a very sterile intestinal tract, and it's going to take them longer to get these bacteria in. So one of the problems with this pathway is that we use mouthwash, and that kills the bacteria in our mouth and our tongue. Or we brush our tongue, that kills it. The other thing we do is we affect this next level right here by taking stomach acid blockers. So now instead of a stomach that's a pH of 2, it's a pH of 7. You can't convert nitrite into nitric oxide, so you don't make nitric oxide well. And they did a study on dental students where they said, we want you to use mouthwash twice a day. Within a week, 34% of these students had hypertension. So these are just, I mean, we don't think about this. We just say, oh, I need mouthwash because I got bad breath. Well, you have bad breath probably because your stomach is off and you're making bad gases in your stomach. You're not drinking enough water, not flossing, not brushing your teeth like you should. So just talk to your dentist about that. And I'm not sure that they always are recommending mouthwash. Okay, so let's see, we kind of beat that one up pretty good. Oh, here we go, 8 cofactors to run that enzyme. Okay, so this, I know this is confusing. Some of you are going to hate this and zone out for a minute, but I just want you to understand, I want to tell you the story here because this is the enzyme there's an enzyme that makes this reaction, and my mom and dad have a genetic defect where they only make this 60% of the time. Guess who else has the defect? Me, right? Because I got it from both of them. So with this defect, if this is like a series of, you know, cogwheels on a watch or something. If this pathway doesn't go, then this doesn't go, then this doesn't go, and this doesn't go. And look what we have right down here. Well, here's the homocysteine that you can have measured in your blood. And if this isn't going this way and this way, then there's a buildup of this, and that injures the lining of your arteries. And the way you fix that is, oops, not that. What will drive this reaction forward are the cofactors of folic acid, B12, and B6. So that's the reason I take a complex, B complex every day. I want to do everything I can to get rid of this so it's not high, and I'll show you in a couple weeks how I did that. Just a B complex. Makes your urine turn really yellow, kind of disgusting, but it does a great job in fixing this error of metabolism that a lot of us have. Okay, and because my parents had this, didn't know that, another 20 years and they have heart disease. They're having bypass surgery. So hopefully I will be able to avert that. But when this doesn't turn, then the downstream effect is you're not making nitric oxide. This enzyme, nitric oxide synthase, is not working well. And so what that leads is to a reduced production of nitric oxide. So this problem alone, having this deficiency, can lead to low nitric oxide levels and high blood pressure. Guess what was happening to my blood pressure 2 years ago? It was going up. And I wasn't taking the B complex regularly, and I wasn't taking the Neo 40, and now I am, and my blood pressures are great. Okay, so these are the cofactors that you need to run this the way it should be run. Okay, so we talked about Dr. Brian, right? And this is the supplement that we recommended. Here's another interesting study that, you know, people think salt is contributing to high blood pressure, and it does to a small degree. But this study was done fairly recently, 2017, and this is Journal of the American Journal of Medicine. Pretty interesting. This is a quote right from the article. Certain evidence suggests that added sugars, not salt, may be a dietary culprit for causing hypertension. So have you ever heard of that? Sugar can cause high blood pressure? Again, if you want to try this, try it. Check your blood pressure, then eat a bunch of sugar for a couple days. I know if I do that, I get a headache, my blood pressure goes up. Another study, the link between dietary sugar intake and heart disease mortality. We observed a significant relationship between added sugar consumption and increased risk of cardiovascular mortality. Right there. Now, I made a note here that association and relationship does not prove that one causes the other. But clearly, when you have too much sugar in your diet, there appears to be a link between heart disease. So if I had heart disease developing, I would really be careful about sugar intake. Then another study showing the association between the duration of abdominal obesity, how long you have a big belly, in young adults, and heart disease and calcification in the arteries. So longer duration of overall and abdominal obesity was associated with coronary artery disease and its progression in midlife, independent of how much fat you had. Okay, so just having a big belly when you're younger can put you at risk. Preventing or delaying the onset of obesity in young adulthood may lower the risk of developing atherosclerosis through middle age. So you really don't want to carry that big belly around. That means you've got inflammation. Okay, and so I made this comment here that obesity increases inflammation, and the longer you're inflamed, the more atherosclerosis can be developed. And then I talked about how protective testosterone and estrogen are. I guarantee you, women, you don't have any heart disease in your family. We do a hysterectomy at 20 or 30 because you're bleeding for some reason. Take your ovaries out. Your risk of heart disease at the age of 50 is going to be much, much higher. And every man who would treat for prostate cancer by knocking out his testosterone is going to have heart disease if he lives long enough. It's not, I'm not sure, I think there should be a better approach to treating prostate cancer than wiping out something that helps a man feel decent. Without testosterone, men get very depressed. They can't control their bladder. They gain weight in their belly, which causes all this to get worse. I just think our approach to that is kind of backwards. Okay, so women with hysterectomy in their 40s have a 7 times risk of heart disease if it's not replaced. Men with low testosterone, if a man's testosterone level is low, his estrogen level is low because you make estrogen from testosterone. If they're both low, it increases your risk for heart disease in men. This is from the study. And if you ask Dr. Esselstyn what's more protective against heart disease, diet or hormone levels, anybody follow Dr. Esselstyn? Okay. What would he say about this? Diet, exactly, he would, because diet is everything. But there's good evidence that hormone levels may be just as equal. Okay, I have a friend who went on his diet, and he already had a stent put in, and he developed erectile dysfunction on his diet. Like, that shouldn't happen, right? It should have helped his nitric oxide. And then there's this doctor that I met a couple years ago, Randy King. This is his wife, Carla. Randy's from Louisville, Kentucky. He's an OBGYN. He's doing everything. He's delivering babies. He's doing cancer surgery in women. He's got this hormone clinic. He's working 80 hours a week, burning the candle at both ends. This is his new wife of about 3 years. She's a nurse practitioner. She's helping run this wellness clinic where they're taking patients like all of us, putting them on hormones, and they feel great. So I met Randy several years ago, told him about Fit for Life, and we talked about it. And then at lunch, I was the keynote speaker at lunch, and he was sitting at my table, and I said, you really ought to slow down. You're doing so much, you're 55. Why don't you just slow down and stop doing some of this stuff and just do the things that you really love? He said, yeah, I need to do that. Well, the night before, Friday night, Carla was telling me about this. So anyhow, this was Saturday at lunch. I was talking to him. Sunday morning, Dr. Rouzier starts the conference, and I said, I'm sorry to tell you that Dr. King died last night in a hotel room. And we're like, geez, what happened? Well, actually, I knew the lady who stayed up all night with his wife, helping her deal with this. He died in his room, his hotel room, had a massive heart attack. He told me, he said, I don't have to worry about heart disease because I got my testosterone levels optimized. And he was diabetic, and he had a family history of heart disease. So he should have known better. So what the story was is that he was going out that night after we had dinner. he said, let's make a run to the fast food store. I need my munchies. So comes back from the fast food store with Fritos and candy bars and pop, and he had all this sweet garbage. And Dana, the lady that stayed in the room with Carla, said, I couldn't believe all the stuff that he ate that night. What happened is he collapsed on his bed and had a seizure at about 11:30. And he came around, woke up, and she said, are you okay? What was that? And he had another seizure. So she knew something was wrong. He wasn't responsive. She runs out of the room, banging on doors down the hallway because there's doctors everywhere on this floor, and she forgot her room key, locked herself out. So when they finally got in, 3 or 4 doctors came in, and he was already gone, massive heart attack. So the point here is, yes, testosterone can reduce your risk, but what did I say at the beginning? Family history, diabetes, and we just showed you that sugar can increase your risk of heart disease. It's like he should have known better. He overestimated the value of testosterone and underestimated the family history and the diet. And it was tragic. I mean, he just died that night. So we changed our diet over the last 100 or so years, and we talked about this kind of an overview. So one of the things that we've done wrong is we're eating flour products, processed foods with enriched flour. So hopefully now you understand why it has to be enriched, right? Because when we were making bread initially in the 1920s, we were grinding it up right off the farm, but it would go bad because that wheat kernel had a wheat germ in it, which was 2% of the weight of the kernel, but had a lot of fat in it, fatty acids. So when you expose this fat to oxygen, it goes rancid, it doesn't taste good. So it wasn't selling on the shelves. Everybody's moving off the farm into town because of the car industry and the other industries. So they said, let's take that out, throw that away. And bread sold better, it stayed on the shelf longer. And then by 1936, we found the study that said Americans were deficient in all these micronutrients. So instead of saying you can't do this, they said, oh, well, we can fix that problem. Let's just mandate, we'll pass an act of Congress, and we will tell them they've got to add these micronutrients back into the product. So when it says enriched and fortified with vitamins and minerals, that's what you're putting back into it right there, right? It wasn't that it's fortified, they're just replacing what they stripped because it's a law, they have to do that. Okay, but the point I was trying to make with this is they didn't do that with magnesium and zinc and folic acid and fiber. So folic acid is part of that homocysteine issue that I talked about. Most of us don't get enough, and pregnant women have to take folic acid to really help them to prevent neural tube defects. And magnesium is the most common mineral deficiency. If you have leg cramps at night that wake you up, it's probably because your magnesium is low, and you need a good quality magnesium to fix that. Okay, so this stripping of these nutrients by throwing out the wheat germ, we have no idea about these other trace elements. Selenium, a lot of us are low in, molybdenum, boron, cobalt, all of these. That's not in this product. So these are things that are in a package. They're all going to say enriched. They were taken out to extend the shelf life of the food. Then we talked about fats, the inappropriate balance of fats. Trans fats are not found anywhere in nature except for ruminating animals. You find it in the stomach, one of the stomachs of a cow, but you don't find that compound anywhere else. So does that belong in our bodies? Probably not. If nature doesn't use it, then in anything, you don't find it in bacteria, you don't find it in animals and plants, it's not in humans, it probably should not be something we're consuming, but we use trans fats because they prolong shelf life. And then we eat way too many of these omega-6 fats and not enough of the essential omega-3 fatty acids. So it's like a 10 to 1, 20 to 1 increase. This should be 4 parts of omega-6 to 1 part of omega-3, and we're more like 20 here and 1 here. And these fats are very inflammatory. If you eat a lot of these fats, you're probably going to feel your arthritis pain. If you take those out of your diet, you're not gonna hurt as bad. So we talked about trans fats, what they do. That's basically what I just said. And we talked a little bit about these different types of fats. We have saturated fats. Here we have monounsaturated fats and polyunsaturated fats. And remember the omega-6 to omega-3 ratio that's ideal is 4:1. So does this look like it's 4:1 here? None of these look like 4:1. Corn oil is not 4:1. Corn is what we give animals, to the livestock, to grow them big, right? So those animals, that beef that we eat at Roadhouse is gonna be cows that were fattened on corn oil. They're very inflamed by the time they're slaughtered, and we eat them, and we love it because it tastes so good, because the fat. But the fat is very inflammatory, and then that becomes a part of us. One of the best ones, as far as the ideal ratio, is canola oil. Olive oil is also good, but these are vegetable oils that are not good. So does this mean that corn is bad for us? Not necessarily, but a lot of corn oil is probably not good. Safflower, way too high. Sunflower, can you eat sunflower seeds? Yeah, I think you can, but that shouldn't be your only fat source. Okay, so everybody got that? Just kind of a general message there. Okay, so why is our fat diet not balanced? It's because we don't eat enough omega-3s. We've changed our diet a lot since 1850 because we're not eating fish, and we're eating too many of the fast foods, the vending machine foods. The vegetable oils are very high in omega-6s. Okay, and then we increase our omega-6 consumption because we're eating grain-fed meat, we're eating commercial vegetable oils, snack foods, and fast foods. That's where this comes from. This will make your LDL cholesterol go up, make your triglycerides go up, cause inflammation in your joints, make your arteries more inflamed when you put plaque in them, so worsen heart disease. So we need to reduce the intake of these omega-6s. Okay. The third issue that's changed for us in a bad way is high fructose corn syrup. And most of you know fructose is found in fruit, right? Fruit's not bad for us. But the amount of fructose that's in high fructose corn syrup is much, much higher than nature intended. And we have to make high fructose corn syrup, we have to process the raw cornstarch and put it through a series of reactions to get this syrup out. And the reason food manufacturers do that is because it takes a teaspoon of this syrup to really sweeten up any type of food, your cornflakes or whatever you want to use. It's perfect. It's very, very cheap. It's soluble, works better than adding white sugar to any recipe. It's perfect. But that got introduced into our food supply in the 1970s. And if you remember, I showed you the obesity map started to really go up in the 70s. And the other problem with this, besides raising your insulin level, is these foods make you hungry, right? It increases insulin and it increases ghrelin, so you're hungry. And we're trying to not have that stimulus to always feel like we got to eat. So we really want to keep this as low as we can in our intake. But everything you buy in the store is going to be sweetened by, it's going to say corn syrup or high fructose corn syrup or something that's corn syrup. We want to really minimize that. So you're always going to be safe in the produce section of the store. This is one of those things where we could all get really OCD about it and say, I'm never eating that stuff again, but it's probably not going to happen. You're going to have it at some point. So we're just trying to understand what it does and improve on our dietary habits. Okay, this is high fructose corn syrup.
Question?
Yes.
What about maple syrup and honey?
Maple syrup and honey, those are natural, much better. They don't have the same impact on the feeding center in the brain, so that's a better choice. It's nature's sweetener, so I don't see a problem with it. I'd just say be careful you don't use it in excess, because it'll raise your insulin. You raise your insulin, you're going to start making fat. So just respect it. So this is just showing you that the fact that when high fructose corn syrup entered the food supply, the total calories from sweeteners went up, and it followed the obesity map. And the obesity map is not coming down. We're getting heavier and heavier because the food manufacturers love high fructose corn syrup. It sells. People don't understand how harmful it can be to them. Then there's a lot of sugars in disguise. And when it says a natural sweetener, there's no legal definition. It could be anything. It could be maple syrup or honey, but it could be corn syrup or high fructose corn syrup or brown sugar. So you just have to be careful when you see these terms. The food labels are there to give you information, but primarily what they're trying to do is sell you the product. So they'll tell you things that will entice you and make you feel like you're getting something you want. Okay, so there's oxidative stress and inflammation and obesity. I mentioned this. You can measure the C-reactive protein. This was just a study that showed it. This showed that if you cut your calories by 1,000 calories a day for 4 weeks, there's a significant reduction in inflammation. We can measure that in your white blood cells. So this kind of goes back to the idea of a keto diet or a low-calorie diet. If you really cut your calories down, you'll be less inflamed and you'll probably live longer. Okay. This was kind of an interesting slide I came across. When it comes to nitric oxide, this is basically saying that what we already know about nitric oxide, it dilates blood vessels. But if you're insulin resistant, you will not you won't release nitric oxide. So who is going to be somebody that is not who's going to struggle with their nitric oxide production? What group of people? Diabetics, exactly. Yeah, they have more heart disease and they have more hypertension, but nobody tells them the root cause of that. Like that's driven by too much sugar. And then what do we do with diabetics that we can't control with pills? We give them insulin. That's going to make it worse. Like, let's fix that. Let's really work on the diet. That's really good. You guys are really on top of this. This is showing you how sugar causes a decline in cognitive function. This is pretty interesting. This American Journal of Medicine. Higher hemoglobin A1C is associated with lower cognitive function. How would that slow down your cognitive function? Higher insulin, more inflammation. You're not going to conduct the electricity in your brain as well, and everything's going to slow down. This is one showing you connection with Alzheimer's disease and different things that are associated with it. So we know the older you are, the higher your risk of Alzheimer's disease. We know that the lower your education, the higher your risk of Alzheimer's disease. But look at this. See these numbers are showing you how significant it is? But look at this. Abnormal glucose tolerance, in other words, high blood sugars. This is almost as highly correlated with Alzheimer's disease as getting older or as your education level. And then we've got fasting plasma glucose. That's not as strong of a factor. 2-hour glucose, like we would give a woman and say, oh, you got gestational diabetes. That increases your risk of Alzheimer's disease down the road. That's too much insulin. It's inflammatory. And so we have all these links of all these things that we fear. And all we have with Alzheimer's disease is Aricept and these medicines that slow the progression. We're not talking about prevention, which is what we're talking about here. You guys should be really empowered against all these diseases you fear by the things we're talking about. Are you insulin resistant? How do you know if you're putting yourself at risk? Well, here's some of the things you can look for. Do you have high blood pressure? Do you have high triglycerides? Do you have a family member with diabetes? Or do you have polycystic ovaries as a woman? Erectile dysfunction as a man? A fatty liver, which means you see that with high AST and ALT on your blood tests? Or do you have skin tags? Some people have a lot of skin tags. I thought that was an interesting one, but that is telling you probably, skin tags are abnormal growths. What causes things to grow abnormally? Insulin does. So if you have skin tags, you're getting them clipped off of your neck or in your armpit or your groin, you probably have some insulin resistance. And you're kind of going down a path you don't because you're eating, for you maybe not be eating as much sugar and carbs as your friend who has no problems, but for you, it's not something that you want. This is showing you, what is this showing you? Diabetes and the risks for these different conditions. Okay, so heart disease, diabetes really increases your risk. But you can see there's a risk with cancer. See, the risk of cancer is pretty high with diabetes, really high. And then some of these other ones, stroke is a little bit of association. I mentioned Alzheimer's disease, kidney disease. So these are two different time periods, 2 different years, but there's an association with diabetes, which is an inflammatory state, and heart disease, which is an inflammatory state, and cancer, which is an inflammatory state. Annual mortality, heart disease versus cancer. So what does this slide tell you? So cancer is in red, heart disease is in blue. Just a simple message. Cancer rates are going up, right? Heart disease rates may be coming down a little bit. Cancer rates are going up. Here's a really important one, because we talked about COVID. I mentioned COVID early on. I think we do a poor job of helping people understand what puts them at risk and how to reduce their risk of getting really sick. So this study was just published recently, and this tells us, these are characteristics, comorbidities, and outcomes among 5,700 patients who were hospitalized in COVID early in the pandemic. And what they found is these sick people, 60% of them were obese, 53% of them have hypertension, 31% of them had diabetes. There's a common condition among those 3 groups. Do you know what it is? A common state, begins with an I. Inflammation, right? So what happens when a COVID patient does poorly? After the virus replicates, after the 10th day, the body says, we don't like this virus. We have to cause an acute inflammatory state to kill, like it does everything. Like, I'm having acute inflammation in my arm helping me heal this. But when you have COVID, you get more inflammation. And if you have underlying reasons for inflammation, now there's more and more. And then the lungs get stiff and they don't move and you don't survive it. So my sister-in-law had COVID last fall. She was on the ventilator for 3 weeks and she died of COVID, 62. She was obese, she had hypertension. She was predictably going to do poorly. And that's a shame. So again, we don't want to have a lot of inflammation. And this study, this article kind of bears this out. This is pre-diabetes and brain atrophy. You don't want your brain to get smaller or less functional. And this is a quote right from this article. Brain changes suggestive of cerebral microvascular dysfunction are already apparent in patients with pre-diabetes. So cerebral microvascular dysfunction means they're going to be at risk for Alzheimer's or some type of dementia, and they're going to be at risk for stroke. And we're already seeing those changes in pre-diabetics. Then he says further analysis will also look at cognitive decline and the development of dementia in this group. We also intend to look at the association with other outcomes of cerebral dysfunction, including depression. So an inflamed brain because of too much insulin, too much sugar, can lead to all these conditions, cerebral dysfunction and even depression and dementia. You see the price we pay to eat foods that are sweet? And I'm not seeing you, I'm looking in the mirror right now, because I struggle with it. I just have a bad sweet tooth, and I struggle with it, and I know that I have to do better. This is a summary slide that takes a food right off the shelf, and you'll be able to do this in 2 or 3 weeks when we get to food labels. But can you see, we talked about the 3 things we talked about: high fructose corn syrup, enriched flour, and hydrogenated fats, right? So look at this. Tell me what you think. The first thing is enriched flour. Well, you think that's good. That's got fortified with vitamins and minerals. It is, 4 of them. Everything else is deficient. So this is deficient flour. Secondly, and we need those micronutrients. We need magnesium and all this zinc and all those other ones. Second problem with this, third on the list after enriched wheat flour, is water And the third most prevalent ingredient is high fructose corn syrup. Why would they put that in bread? We just gotta make it just sweet enough that it's pleasant, right? But you have 2 or 3 slices of these. If you're like me, I'm not gonna stop with 3 slices. I'm gonna keep eating. That's one of the reasons why you feel like this need to eat. And then the fourth or the third problem with this is it's partially hydrogenated soybean oil. That keeps this on the shelf. And this, if you get this and you keep it sealed, it doesn't mold for a long time. Of course they'd want to put that in there. Of course they'd want to use high fructose corn syrup. It's cheap, and these oils keep it on the shelf long. So it's to their advantage, but it's not to our advantage to be eating these. Total carbohydrates, 14 grams. That's one slice. And I'm telling you, if you want to lose weight, most of you are going to have to eat 50 grams or around there. That means you get 3 slices of this a day, and that's all your carbs. Everything else is protein and fat. No vegetables, because they have carbs. No berries, because they have carbs. And this will make you hungry. So this is a poor choice if you're trying to lose weight. It's not a terrible choice now and then, but if you're trying to get healthy and lose weight, it's not the right choice. And then we just eat way too much, right? We just underestimate how much foods are. Okay, so the question is, what if I I'm 70. Can I do something positive now? What if I start cutting my calories back at 70 as opposed to starting earlier in life? Will that be beneficial? And the answer is yes. At any age, you can slow how fast those telomeres are shortened. You can slow the aging process. So everybody can do something with this. It will extend your life. It delays the onset and progression of cancer. Cancer feeds off of calories. If you're in a calorie deficit, you're not going to give the cancer much to feed on. So it's never too late to start. And then if you're like me, I'm thinking, you know what, I want to have my bread and I want my chocolate chip cookies and ice cream every now and then, but I'll exercise a lot. I've been telling you about this slide for 15 years, and this slide here, and I'm stuck on the previous slide. That's what I need to be doing. And what I struggle with is this. Does exercise extend the lifespan as much as calorie restriction? And it doesn't. You cannot. The Biggest Loser show proved that. You can exercise a ton and eat pretty good, but if you're losing weight because you're exercising 3 hours a day and burning a lot of calories, you're going to gain it back. And they all have gained it back, and then some. So exercise is not the best way to lose weight. In fact, you'll get discouraged, you'll get hurt. The best way to lose weight is keeping your carb intake down, your sugar intake to a minimum, and then optimizing your thyroid. And women, you've got to fix your estrogen level if you want to keep the weight down. If you're some women don't have an issue with it when they get older. But if you put weight on around your belly, you're probably not going to get that weight off very easily. You're going to really work hard to even get half of that weight off. So that has to be part of your program. Okay. So this is a summary of what we talked about this week. Enriched flour is depleted flour. These trans fats lead to heart disease. The omega-6 overbalance in our diet leads to inflammation. High fructose corn syrup increases insulin, which causes obesity. It increases the hormone ghrelin, which makes us starving, makes us want to keep eating, those carbs especially. And supersizing and eating too much at the wrong places is giving us a lot of calories that taste great, but they're very poor in nutrition content. You're not getting magnesium and selenium and the micronutrients you need to prevent heart disease and all those other things. So this week, I ask you to be careful. Start looking at your food. If you go through your pantry, you're going to end up throwing all your food out because it's all going to have this, which you're not going to do, right? I just want you to feel guilty and terrible when you eat it. All right, so that is what we're going to, this week's presentation. So next week, we're going to tell you how to heal with food, because food has the clues to help us heal, and that'll be a cool one too. So you guys are right now kind of getting into the crux of the middle of the meat of the program, which is really important information. So I'm going to turn the mic off. And then Kelly got us these specimens from the pathology lab at Alton.
Hey, just a minute, I'm bringing out a
Okay.
I have one question.
Yeah.
Is there any butter substitutes that are good for you?
Butter substitutes?
Yeah, like some type of margarine?
No, I think butter is the best choice.
Really?
Yeah. Yeah. Now, especially if you're gonna fry with it, it's better to use that. But if you're gonna use a butter substitute, like a spread, like canola oil with butter in it, like Country Croft or one of those, canola oil is pretty decent, and butter is not gonna hurt anything. It's got a higher melting point, so it'll be stable when you heat it up.
I'm gonna slide back if you don't think on the other side. That's all right, I'm gonna slide over there.
How big is your heart supposed to be? Size of your fist. Some people would have a bigger heart, some people smaller, right? Okay. Everybody had dinner, or am I gonna ruin dinner? All right. So this should be the size of my heart. When a heart is big like this, it doesn't mean that you're a really empathetic person. It means that you have congestive heart failure. So instead of the heart doing this, it's just weak and it doesn't squeeze well, okay? So it's huge. And this is a kidney that's all atrophied. It's a polycystic kidney, okay? So there's a correlation between heart disease and the kidney. This says hypertensive heart disease secondary to chronic kidney disease. And this was an endocarditis, an infection of the heart lining that led to a heart attack. There's a lot that I can't really show you very well. Maybe the people on video can see right there. That is the valve, the heart, one of the heart valves, or yeah, one of the heart valves. I don't know. You have to come up closer to see this. My index finger is on the valve. It's really thin. It should be almost translucent. This one has got a bunch of calcium in it. It's a very stiff calcified, I think it's the aortic valve. Okay, so it's not closing right. You'd have to almost come up and feel this because it should be paper thin. Okay, so that's a congestive heart failure heart.
Right. Some of you had bypass surgery. This is a bypass surgery heart here.
That's a vein from the leg. There's another vein from the leg. Here's another vein. This is actually 1, 2, 3, 4, 5-way bypass. And if you come up closer, you can see the stitches that they put in when they did this bypass. So they have to stop the heart, right? You can't sew this in when the heart's beating. So they put you on bypass, so your blood goes through a machine and gets oxygenated, and the heart stops so they can sew this up. And then they sort of shock your heart back into rhythm, and it works beautifully. It's amazing. They do this like they're changing oil in a car. It takes them a couple hours, but it's just amazing. So what we see, remember what I told you about these graphs? We tell veins to act like arteries, and I told you it doesn't work well a lot of times. This vein graft and this vein graft are purple because there's clot in them. It's already clotted, it's not functioning. This is perfect. This is real thin and it's weak, but it's clear. This is not what we want. My mom had a 3-way bypass, and in 4 weeks, she already clotted off one of the venous grafts. It just happens. Veins are not supposed to act like arteries, but we're doing our best. We haven't fixed the problem. We just bypassed it until another problem occurs, right? Because we haven't fixed the root cause, which is inflammation. Okay. And what does this say about this? This is a 53-year-old man with a long history of hypertension, diabetes, and cigarette smoking. Admitted with increasing angina. 5 days later, he developed an inferior wall, the lower part of his heart infarcted. He went into cardiogenic shock and expired. And it says, note the thrombotic occlusions on the venous grafts, which I showed you. 55 years old, didn't understand what he was doing or could have done better. Anybody getting hungry yet? What's this? Okay. So this is a valve replacement. The aortic valve and the mitral valve have been replaced because they weren't closing properly. I always have to look to find the valves here. Okay. There's the valve right there. It's opening and shutting right there. And if I can, if I can open this up, can you see that little valve? It swings open there. You see that? You guys see it in the front? That right there? There's two of them. There's one there and there's one over here on my middle finger. So it clicks back and forth as it opens and shuts. If you sit next to this person in the movies, you can hear it click, 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 click. So this person has to be on blood thinner because that's not natural and that can clot, right? So, but that's how we fix it. And often now we're instead of cracking the chest, we're doing some of these valve replacements right through the artery. So there's nothing really invasive, which is amazing.
And what do you fix the valve with?
Well, this is an artificial valve, and sometimes we use pig valves. So there's animal valves and then there's artificial valves.
Looks like the guy died.
What's that?
The guy died
Yes, yeah.
from the valve replacement or?
I didn't say what he died from, or she, I don't know, it didn't say. Here's another bypass graft. If you see that, where that vein split open, you can see the clot in there. There's a little slit in this vein. That's the clot that occluded, probably had another heart attack result of that. So this in the front here, this vessel is an artery. This comes right off the chest wall. It's called the mammary artery. We usually use this to bypass the widowmaker artery going down here. This usually works really good because we're telling an artery to act like an artery. But this is a vein, that's clear. But there was one of these veins here that, well, right down here, it's not clear because it's got clot in it. Okay, so again, this is a 1, 2, 3-way bypass. It splits right here. One goes to this area, one goes to this area. So 3-way bypass. What's that?
That's a wet one.
Yeah, it's a juicy one. I'm having fun.
You are.
Okay, here's your, I think this is the pig valve replacement. Right there. See that valve? That's the pig valve. Yeah. Yeah, this person really liked a lot of bacon. Okay. All right, so we're good there. Okay, let me move this. Okay, almost done here. I'm almost ready to build Frankenstein. All right. Here is a slice of liver. Did you bring the onions? All right. This, it should be pink. This is a fatty liver. Okay, it's got these yellow deposits. This comes from having a big gut. You get a fatty liver from a big gut. You can get a fatty liver from alcohol. Okay, so it's got that yellow appearance. Then we'll show you what happens when this progresses with your liver. You can see the difference. See the difference between these two? Let me see here. See the difference in color, texture? So the one on your right has a cobblestone appearance. That's cirrhosis. That means the liver has really been injured so much it's not going to function well. And the liver is supposed to act as a toxin cleaner for everything you put in your mouth. So that's irreversible. This is reversible most of the time. You lose weight, lose your belly, and it'll turn pink. If your AST and ALT liver enzymes are elevated, you probably have this. Okay. This, anybody know what this is?
Pancreas.
Nope. Somebody said lung? Yeah, it's a lung. It's, these are the little airways. This is the outside of the lung. And it should be, actually, this is the bottom here. You can see it's a little dark on the outside here. This is probably from secondhand smoke exposure. On the bottom, this is really soft and spongy, but on the bottom you see this sort of area where there's a lot more holes in it. That's emphysema. That's what emphysema looks like. Except bad emphysema would look like this everywhere, okay? And right where my finger is right here, there's something really firm and rubbery. That is a lung cancer. Okay, that's what it looks like. So part of this is what a healthy lung looks like. This is not real healthy here. And obviously the cancer is not, it feels, this is real soft, this is really firm and rubbery. You can start stacking them up a little bit. Anybody know what this is? Yes, this is an artery. This is the aorta. Nice, it's beautiful, right? Smooth and pink. The size of this tells us this was probably a child under the age of 10. So for whatever reason, we got that specimen, okay? On the outside of it, you see these fatty deposits. We're never gonna get rid of all of our fat. We have to have some fat. So even a lean bodybuilder is gonna have 7% body fat because we need some fat around our organs. Okay, so that's a healthy aorta. These little holes in it are where the branches come out from different blood vessels.
Is the inside the inside?
Yeah, this is the inside. Yeah, we just laid it open. Yeah. Yeah, I'll put another one on it. Okay. We're going to kind of progress through this. What does that look like? It does. It's another aorta. It's not perfectly pink. It's got some fatty streaks in it, right? Just keep that in mind. It's not the worst. We're going to see worse. Okay, let's show them worse. Yeah. Okay, this is worse. You see that plaque? If you run your finger down, it's hard. It's calcified, right? And you see this funny looking thing here and here? This is the level of your belly button, where it splits and one artery goes down to your right leg, one to the left leg. And they did something here. They sewed in a graft. See that funny looking on both sides? This person was having problems with blood flow in their legs. Their legs were aching and hurting. So they sewed a graft in to restore the blood flow. Here we go. And then, I don't know if sometimes on these, can you see the light when I shine this up or hold this up? Can you see how the light kind of goes through right there? Can you see that? Right there. It's real thin and the light shines through it. Show you, Debbie, right there, right there. Get the light. That's the beginning of an aneurysm. Okay, so when that gets bigger and starts to rupture, you got problems. All right, one or two more and we'll leave that. Yeah, she's loving it more than she thinks. All right, there's another aorta with a lot of plaque in it. You see this translucent area right down there? Can you see that with the light? That's another aneurysm. That's more progressed. Okay, and this is some really hard stuff here. This is calcified plaque all through here. Okay. I don't know what this is. What is this?
New. Look at that. What is that? We haven't seen that before.
Oh, this is yeah. This is another Gore-Tex graft, an artery with a lot of plaque in it, and I think there's a blood clot in this artery right here. So we don't want our arteries like this. What would you, if I ask you, can I get rid of this? Do you know what the answer is? Depends on who you ask. If you ask Dr. Esselstyn, he says, yeah, let me show you the evidence. 85% of my patients can reverse this with a very, very strict diet. Most people won't do that diet. It's complete vegetarian. But we can improve this. Maybe not back to normal, but we can improve it. Okay, so that's all I have. Does anybody have any questions? I know we have to get out of here pretty quick. But if anybody wants to come and put some gloves on and touch any of this or look at it, we'll stick around.
Come on down.
The plaque?
If you want to touch, get some gloves there.
Where's the aneurysm?
Aneurysm.